Okay, thank you for attending this session where I'll be running through a guide to sample collections. I'm Adele French, I'm the sample collector trainer here at LexTalks. So on the agenda, we're going to go through a brief introduction on the importance of sample collections, some tips on how you can prepare the donor for our arrival and to make the collection go smoothly. We're going to go through some frequently asked questions, and then we'll end with a summary with some finishing points and highlights and how you can get in touch with us. So the importance of sample collections. At LexTalks, we pride ourselves on the expertise of our sample collectors. Our team are trained to collect samples sensitively and sympathetically to ensure minimal discomfort for the donor. The collection process is an integral aspect of the whole sample analysis process. We like to ensure the analysis is right first time, so it's imperative our sample collection is right first time. The sample collection process is essential in meeting turnaround times and ensuring that case and court deadlines are met. Our samples need to be collected under strict chain of custody procedures to ensure the result is legally defensible to use in court. So if you could prepare all donors in advance as to what to expect during the sample collection and what to expect when our collectors arrive, it just ensures things go much more smoothly. So preparing the donor for a sample collection. On arrival, our collectors will ask a series of COVID-related questions to help minimise the spread of the virus. Before any sample collection can take place, we have to be able to identify the donor. So our collectors need to see some type of identification to ensure we are collecting the sample from the correct person. We understand some donors may not possess any photographic ID, such as driving licence, passport. Their ID can be verified by a solicitor, a social worker, or a witness that is present with them at the time of collection. The identity of a child or any children needs to be verified by the person or party who has parental responsibility. Our sample collectors know they can't proceed with any collections unless that named person is there and they can identify that child. So part of the chain of custody procedure, donors will be required to provide a signature consenting to the sample analysis, and they'll be asked for a photograph to be taken. So we can't proceed with the sample collection unless the donor has given us a signature of consent and has agreed to have a photograph taken. So on arrival, if you could prepare the donor to have a list of medication, it's really helpful for us if they can provide prescription meds as well as purchase meds, things they purchase themselves. So all these can be declared at the time of the sample collection on the chain of custody form. This just ensures that any prescribed medication is taken into consideration when interpreting the analysis results, and it's included into the expert report. So preparing a donor for a hair sample collection. So if you could advise the donor prior to the collection that it's really important to ensure there are no hair products left on the hair at all, such as hair gel, hairspray, oils. It makes it easier for the collector to section and obtain a sample with minimum discomfort to the donor. If any of the donors wear hair extensions, they need to be removed prior to the sample collection. So when we actually collect samples, if we're taking a head hair sample, our collector will section the hair. They'll do it discreetly, they're not going to make anything very obvious. And we like to cut 2 samples of hair as close to the scalp as possible. We'll take approximately a pencil width of hair. However, there are cases where more hair may be needed as the weight and texture of hair varies from one individual to another. So obviously if somebody's got fine hair, we just might need to take a bit of a thicker sample, for example. So preparing the donor for hair sample collection. So at the actual collection, if the hair is being tested for spice, Psychoactive substances or steroids, more samples will need to be collected, so it will be more than 2 samples. In cases involving body hair, the sample sites will vary depending on what tests are required. So again, if the donor has no head hair, we can take sample hair. If the hair is too short for us to cut, we can take body hair. So for an alcohol analysis, a sample would be taken from the chest, leg or forearm. And for drug analysis, underarm, chest, legs or arms. So preparation for blood samples. It's important to note we offer 3 types of blood tests at LexTox. We offer a liver function test, which is known as an LFT. We offer carbohydrate deficient transferrin, which is known as CDT, and then we also offer a PEth testing. So if prior to the collection, if you know your donor's having blood samples taken, it's highly recommended that the donor drinks plenty of water to hydrate their veins. Drinking water before the blood test just makes it much easier to extract a sample. It's much more comfortable for the donor. So at the blood sample collection, our collection technicians will take a blood sample using a vacutainer needle. It's a very quick and easy process. This needle's just inserted into the vein and then we use that to draw out samples of blood. There may be a small feeling of pricking or scratching as the needle goes in. It shouldn't be a painful process. Our collection technicians are trained phlebotomists, so they have vast experience on taking bloods from a variety of different people and patients. So preparing the donor then for a DNA sample collection. So prior to the collection, it's recommended that the donor does not eat, drink, smoke or chew gum for 30 minutes prior to giving a DNA sample. So in order to take the sample from the donor, we need to obtain an oral fluid sample for DNA. So our collection technicians would need to take a swab of the inside of the cheeks, just up near the back of the teeth. It's a very quick and simple process. Okay, frequently asked questions. So one of the questions we get frequently asked is, will exposure to a drug lead to a positive result? We have quite a number of procedures in place to prevent a positive result from exposure. One of these is washing the hair sections prior to analysis. Okay, so the use of methanol to wash hair samples is considered to be the most effective for decontamination, and it's the method applied by LexTox. Our experts analyse hair samples and their metabolites. This is a substance produced by the body when a drug is ingested, and it can be used to indicate direct usage. So reporting cut-off levels are also applied to minimise the detection of drugs from people who are exposed to them and are in place to show repeated use of a drug. Okay, we've been asked this question quite a lot, especially through the pandemic, COVID-19 pandemic. So in response to the COVID-19 pandemic, many of our normal hygiene practices have changed dramatically. So the use of hand sanitizers, even ones that contain alcohol, will not give rise to positive results at LexTox. The alcohol biomarker ETPA can be elevated by the use of products containing alcohol. As long as the product is being used as per the manufacturer's guidelines, then the use of hand sanitizer will not affect your client's alcohol test. So as long as they're using it on their hands as per instructed on the bottles, it won't affect the alcohol test. So similarly, the use of hand sanitizers will not affect blood tests either. So can hair products, bleaching and/or hair dye affect alcohol results? So both ETPA and ETG are sensitive to the use of cosmetic treatments such as hair dyes and hair bleach. The frequent use of hair products containing high concentrations of ethanol may elevate the levels of ETPA detected. So we ran through some questions on the chain of custody forms, asking the donors to declare any products they use. Aggressive chemical treatments may reduce or remove the levels of ETPA, and so a not detected result is not a definite indication of abstinence. Any questions you have regarding hair products, hair dye, on the alcohol results, our experts are on hand to provide guidance and advice on chemically treated samples. So as I discussed previously, body hair can be used for alcohol testing if no head hair is present. So we can only test from the chest, leg and arm hair when we're checking for alcohol. So underarm hair, pubic and beard and any other body types cannot be analysed for alcohol markers due to contamination issues and an increase of levels due to sweat. So another question our experts are asked is, why can we not segment body hair? Body hair grows at a similar average rate of 1 centimetre a month. However, it's got a different growth cycle to scalp hair, meaning that a greater proportion of the hair remains on the body in its resting or non-growing phase. So for this reason, body hair samples are analysed as a whole sample. We're unable to segment them into a month-by-month analysis. So I hope that's answered some of your questions. If you still have any questions, there's a variety of options you have. You can visit our website for a detailed list of frequently asked questions. You can contact your dedicated client manager. They're able to discuss test options with you in order to help you understand the best option for your case. Our expert reports interpret and explain test results clearly and succinctly to help you make critical decisions. However, if you do have any queries on the results upon receiving your expert report, our team of experts are able to answer these for you. You can put questions in writing and email them over to us at experts@laxtox.co.uk, ideally quoting the laboratory sample number. That will start with an LX. Alternatively, a phone call can be arranged with one of our experts to discuss the results. So to summarise, the collection process is an integral aspect of the whole sample analysis process. Donors should be prepared in advance as to what to expect during the sample collection appointment. You can forward our PDF guide to them in advance. It's helpful to prepare a list of any medication the donor is taking so that these can be declared at the time of the sample collection. If the hair is being tested for spice, psychoactive substances or steroids, more samples need to be collected. Prior to a blood sample collection, it's recommended that the donor drinks plenty of water. And then we recommend that the donor does not eat, drink, smoke or chew gum for 30 minutes prior to giving a DNA sample. So if you need to contact us at all for any further information or to request a quotation, you can email us at experts@laxtox.co.uk. You can visit www.laxtox.co.uk for our online form or to download a PDF form, or you can call us on 02920 484141. Thank you for your time.